Hello, my name's Nigel Hughes. I'm a project lead for EHDEN and a director in epidemiology in Janssen R&D. And it's my pleasure on behalf of the project and the consortium to present on the European Health Data and Evidence Network, sharing the OHDSI journey and a vision of evidence today, not in several tomorrows. I'll give a brief recap, some overview of results and a view on the direction we're taking with the project from here on. Just to summarise, the vision of EHDEN is to create a trusted observational research ecosystem to enable better health decisions, outcomes and care. So the emphasis on the second E of EHDEN, evidence generation. And to do this, our mission is to create a large-scale federated network, so data stays local, of data partners or data sources standardized to a common data model, and obviously OMOP, but enabling the utilization of the OHDSI research framework of tools and methods for conducting large-scale network studies in the European region. So we're a consortium. We're running for 5.5 years, 1st of November 2018 till April 2024. 23 partners led by Associate Professor Prieto, who many of you know from Health Data Sciences and Erasmus Medical Centre in Rotterdam, and myself as project lead with a diverse group of academic, small to medium-sized enterprises, NGOs, patient organisations and pharmaceutical companies, all with a budget of almost 29 million euros, of which 17 million is earmarked for harmonisation to the common data model. And I'll talk a bit about that in a moment. So we were aiming at the start of the project to harmonise more than 100 million health records to the common data model. As of halfway through, we're actually over 400 million estimated health records. So that's not all patients, but their health records to the common data model, which is quite an achievement, again within this federated architecture, within an open science community akin to the overall framework for OHDSI, but data partners, but academia, industry, regulators, payers, governments, NGOs and patient organisations and others. Supported in terms of upskilling to optimise the effectiveness and quality of the research conducted, and very much focused on outcomes and evidence generation so we can improve clinical practice and generate insights more immediately than we've seen with traditional research. We have three pillars, very much focused on the infrastructure and the creation of the network and the platform, incorporating the data partner catalogue and various tools, data quality dashboards and data characterization, so forth, and being able to conduct, again, networked at scale studies, all within the EHDEN portal, which will be forthcoming. Then very much focused in second pillar in research and evidence generation in various different use cases, from drug utilization studies through to HTA and outcome standards, but particularly focused also on methodological development, and certainly also in terms of education and community support, certainly linked to OHDSI Europe, of course, as well. But certainly also in terms of ensuring the development of the community and of EHDEN beyond the IMI phase. So where are we at in terms of the network? So after 4 data partner calls, which are our open calls process, we have 98 data partners in 22 countries, from Norway to Israel, from Portugal through to Serbia and Croatia. And subsequent calls, there'll be a further call 5 later this year, and then subsequent calls in 2022, and certainly focusing on Central, Eastern, Southeastern Europe, which is often underrepresented anyway. We've already made some headway there, but need to improve that, and in various other countries and to ensure we have a diversity across the European region. We're also training and certify small to medium-sized enterprises, small tech firms. We have 26 already. We've certified in 14 countries to date after 2 calls, and the third call we had this year, that cohort of 23 SMEs will be certified later this month, actually. So we'll have actually 49 SMEs trained and certified to assist in working with the data partners in their mapping to the common data model and work beyond that. We're developing the portal, as I mentioned earlier, including particularly the data partner catalogue, which will launch within the project, at least in the remainder of this year, but hopefully all being well earlier in the new year publicly, with various different tools and aspects I've already alluded to. The community is growing in terms of the data partners and the SMEs, as I mentioned, and we run bi-monthly calls and have a community manager now who helps coordinate and interact with data partners on a more regular basis. We have a lot more insights into the work they're doing, the ETL lifecycle, work in terms of mapping to the common data model, and also actually various numbers aspects of the value propositions and drivers for working and collaborating with us in EHDEN. We also have conducted a number of study-a-thons, the first one being in late 2018, and this was very much looking at in orthopedics, actually, in osteoarthritis, in terms of unicompartmental versus total knee replacement, and we had some fantastic coverage beyond that and publications and so forth, which you'll see on the slide. We've had subsequent study-a-thons. The notable one, of course, was the combined worldwide effort, actually, between OHDSI and EHDEN and many other partners around COVID-19, which most of you, I'm sure, are very familiar with to date and the ongoing work. We've contributed to 36 publications, either in preprint or in publications in our first few years, and these are all available via our website, ehden.eu. And we have been conducting considerable work around COVID-19 with our data partners in a specific call for data partners in early part of the pandemic. In April, May last year, we actually have 25 of the 98 who are specifically on COVID-19 and have been working and increasingly collaborating on a number of the studies that are being conducted. We've created the EHDEN Academy, which is the educational resource, of which now we have 1,515 participants to date who have been enrolling and working on the courses that we have been using to train the SMEs in the ETL process and consistent methodology, but also tools, skills and methods courses around the OHDSI framework and research approach. And we're also heavily involved in the OHDSI Education Working Group, which is also represented here at the symposium, to support the expansion and development of our education portfolio within the OHDSI community. We've got multiple collaborations across the domain, very much within the OHDSI framework, but with numerous other organisations in different disciplines and different areas. And we also are looking at clear objectives, I think, in the final number of years of the project, particularly the launch of the EHDEN portal, as I mentioned, developing further research use cases more extensively with data partners and across the network, promoting OHDSI in the community and education, I think, over the remaining time and beyond. But importantly, developing a EHDEN not-for-profit sustainability program, so a legal entity that will take over from EHDEN after April 2024. And in fact, we are now launching that this year, and that's all being incorporated as a legal entity in the Netherlands right now. Thank you very much indeed for the time. It's short, but of course, but hopefully it's giving an insight to a lot of the activity we've been involved in regards to the project. Thank you very much.